In this video, we discuss the cold realities and the myths of what a Trump presidency means for the Medicare Prescription Drug Program. Coming up next on Holy Schmidt.
Holy Schmidt!
It's no secret that the Trump administration is doing things differently and much faster than any other administration in the history of this country. Some call it reckless, others call it necessary, but whatever the case, in his first 22 days as president, he has signed 61 executive orders, and 14 of his 23 cabinet picks have made it through the Senate confirmation process, including Robert F. Kennedy Jr. RFK Jr. will be the Secretary of Health and Human Services, and Medicare and Medicaid both fall under the control of that department. We'll talk about RFK Jr. more in just a moment because he's very important to this discussion. But before we do, let's talk about what's in place now to keep drug prices down. In 2022, the Biden administration signed the Inflation Reduction Act, and embedded within that act was a provision that allowed the CMS, the Centers for Medicare and Medicaid Services, to negotiate drug prices with Big Pharma. And the team went to work and brought the pressure of the government down on Big Pharma on 10 different drugs, very expensive drugs. They used the Inflation Reduction Act to help negotiate, if you want to use the word negotiate, the outcome of those drug prices. And the output of that was that in 2026, these 10 drugs are going to come down pretty significantly in price. And these 10 drugs, by the way, treat everything from arthritis to heart disease to cancer to type 2 diabetes. So it was a very effective first 10. The only issue I have with it is the fact that it was only limited to 10 drugs. You would think that with this mechanism in place, you could apply the pressure of the US government to Big Pharma on dozens and dozens of drugs, but I digress. By the way, if you're new here, hello, my name is Jeff. I'm a CPA turned author turned public speaker. I'm also a registered Social Security analyst, and I have 25 years of financial services industry experience. I started this channel in 2020, frankly, because my father got sick, as many people did during that time, and I went in to help him and my mother with their finances. And my daughter said to me, why don't you take that information and help other people who are in retirement with their finances? And with that, the channel was born. We have over 300,000 subscribers, over 50 million views, and over 4 million hours of watch time. We would love it if you would subscribe and join our family. Many people thought this was long overdue, by the way, because the fact is, big pharma companies do charge the US market more, generally speaking, than other parts of the world. For example, if you take the drug Ozempic, which is a very popular drug here in the US for both type 2 diabetes and weight control, it is far more expensive than it is elsewhere in the world. Ozempic has a cash price of $938 a month here in the United States, but if you go to other countries like Australia, France, the United Kingdom, and Sweden, it sells for less than $100. In most cases, that's not what you pay. If you have drug coverage, your insurance company pays for it. And frankly, that's not even what they pay because the drug company itself probably negotiates that price down. But when you start off with a 9x difference between the United States and other countries, you can only bring the price down so much. So even if it's covered on your drug plan, the fact is a higher cost to the private insurance provider means that premiums go up and out-of-pocket costs are bigger than they need to be under many circumstances. Drug companies will tell you that they need to charge this amount so that they can continue to develop new drugs, but the opponents of this position say, well, why is it that the US has to carry the burden of the higher price? Why not spread it among all of the countries that are buying the drug, if that's really the case? So when the Inflation Reduction Act was passed, a message was sent from the government to the pharmaceutical companies that they're under watch. Gang, if you're currently on a Medicare Advantage plan, we are in what's called the open enrollment period through March 31st. This means that you can make a switch from one Medicare Advantage plan to another with absolutely no underwriting. Some of the reasons that people switch include a premium increase, or their doctors left the plan, or their health condition has changed and there's another plan that covers that condition better, or they now need coverage for prescription drugs, vision, dental, or hearing, or their carrier is leaving the area and they just need to find a new one. Whatever the reason, switching doesn't need to be a headache. We've partnered with Chapter, the only free, unbiased Medicare advisor that searches across 24,000 plans to find one that's just right for you, at no cost to you. They make it simple and easy. Even if you're just exploring your options, they're happy to help. Give them a call at the number on the screen or scan the QR code and the phone number will pop up on your phone. And when you call them, tell them that Jeff Schmidt sent you. Now here's the fear, and it might be a big one. And that is, it's no secret that the Trump administration did not like or does not like the Biden administration and vice versa. And the Biden administration dismantled a lot of the Trump policies through executive order, and the Trump administration is dismantling a lot of the Biden policies through executive order. And more importantly, the Trump administration has said that they want more transparency in the negotiation process with these drugs, something that really hasn't been fully available to the market, if you want to call it that, up until this point. Trump's statement caused a bit of heartburn among 13 senators, including Elizabeth Warren and Bernie Sanders. That letter was sent to RFK Jr. and expressed concern that Trump might do something that undermines the good work that has been done to date with the Inflation Reduction Act. It's also no secret that Trump wants to support American-made products, including the pharma market, I suppose. He's very clear on this, and he's talked about everything from tax breaks to imposing tariffs to support manufacturing in the United States. And of course, he's being lobbied by Big Pharma. According to Reuters, the pharma companies want Trump to fix the Biden law that allows Medicare to negotiate prices for its costly medicines. Now, the word fix means to eliminate it or adjust it in a way that doesn't hurt the pharmaceutical companies, because frankly, the pharmaceutical companies aren't going to lobby Trump to make the law more strict on them. It's going to be the opposite. And if you look at the history between Donald Trump and big pharmaceutical companies, they collaborated very well during 2020 to bring drugs to market, very profitable drugs to market in record speed. It was considered one of the strongest collaborations between government and the pharmaceutical companies in history. In fact, Pfizer and Moderna together made over $50 billion from the drugs developed during that time. So what does that mean for Medicare drug prices in the future? Well, in the words of my old boss, who was an auditor, he said to me, when you're talking to a client, watch what they do and listen to what they say. If they're the same, then you can take them at their word. If they're different, be very careful. So whether you like Donald Trump or you don't like Donald Trump, this isn't a political video, but one thing I think most people would agree is that he's not afraid to say things that are controversial, and he's also not afraid to follow through on those things. And he has repeatedly said throughout his political career in 2016, 2020, and 2024 that he will protect Medicare and Social Security. It's sacrosanct. And his pick of RFK Jr. to head the HHS really signals his intentions. And RFK Jr. has very strong opinions on Medicare drug prices. RFK Jr. has said that he wants a cap on drug prices. Now, he didn't specify just drug prices for Medicare, but drug prices for everyone includes drug prices for Medicare. He's even gone so far as to say he's willing to seize drug patents of pharmaceutical companies if they don't play ball. And he's also said that he wants to end direct-to-consumer advertising by the drug companies. Now, why does he want to do that? Because if the drug companies can create more demand for their product, more demand means that prices go up. Of course, there are laws that don't allow for some of that, but the position that he takes is very clear, and that is to bring down drug prices for everyone. Now, what about the Inflation Reduction Act and the law that allows the government to negotiate down drug prices? Well, two things. First, the HHS has a list of 15 drugs that they plan on negotiating the price down on, and those prices will be effective 2027. The second is that that provision was left alone in the 61 executive orders that Donald Trump has signed. So it does appear that all of these actions are in addition to the mechanism that's already in place with the Inflation Reduction Act, not instead of that mechanism. Just a reminder, if you're currently on a Medicare Advantage plan and you're unhappy or you want to know what else is available, you can talk to our partners at Chapter. You have until March 31st to make the switch with no underwriting. Simply call the number on the screen or scan the QR code with your phone, and the phone number will pop up instantly. Also, if you like this video, check out that video, how ordinary earners can get 77% more on their Social Security payment. This is Jeff Schmidt, and I will see you in that video right there.